Welcome to DBC Diaries episode 37. I'm Josh, here at Dream Body Clinic, and today you're going to see returning patients Ross and Vianey. So they were here last year and did quite a few treatments. They both did the IV. Ross also did both of his knees, and they're back now to do some more treatments. They've decided this is going to be an ongoing yearly thing for them. Just invest in themselves, invest in their health, and the anti-aging benefits of the IV just keep showing that. DNA methylation tests on patients that have come over the years are showing a reduction in epigenetic age versus real age, and we're just seeing awesome results. So doing some more treatment now. Look, we always hope knee treatments are one and done, but some cases they take more than one, especially if there's a lot of cartilage loss, like stage 1, stage 2 arthritis, usually one and done. Stage 3 or stage 4, realistic is that we can take you to like 1 to 2 degrees less, maybe from stage 3 to stage 2, stage 1. I'd say that's like 80% of the patients we treat at that level. Stage 4, maybe we can to stage 3 or stage 2. And then about 15% of patients at the stage 3, we've gotten all the way to full regeneration. One of the big factors there from multiple interviews has been that a lot of those patients are taking what's called undenatured type 2 collagen. It's a real simple supplement that you can take. I get mine from this company. It's Movement Essentials. That's with Dr. Vianey, who's one of our patients, Joint Relief Protocol. Look, there's other options out there, but he's been our patient, seen amazing results, and I personally use it. I like to promote things that I personally use. And so a lot of patients with the best results for arthritis have found taking undenatured type 2 collagen really helps. Same with disc health in the back. So little things you can do. And yeah, stay tuned. Watch Ross and Vianey's treatment. You can learn more about stem cell therapies, how things work here at Dream Body Clinic. I'm Josh, happy to help. DBC Diaries Day 1. So normally this is the day you arrive and rest. Our drivers will be at the airport ready to pick you up. You go outside of the airport, turn left, and you'll see a bunch of people waiting with signs. Our driver will be one of them. For Russ and Vianey, they were already here. They're world travelers. They go all over the place. I think they came in from Brazil where they were traveling for this trip. And so they were already here. So we're not going to show them arriving, but we're going to show everything else. And when you first get here, it's just arrive and rest. DBC Diaries Day 2. Today, Ross and Vianey are going to come in and start with blood work. We always start with blood work. We check blood pressure, we check SpO2 numbers, just height, weight, whole medical workup with our nurses, just to check everything for analysis the next day. And then in the case like for Ross, we're starting with the MRIs. So we do the MRI, it takes about 45 minutes per joint. And yes, each joint is its own MRI. Get asked that a lot. There are full body MRIs now with certain machines in the US, but they only show organs. They don't really show joints very well. So you always have to get a hyper-localized joint. So each knee is a separate MRI, each hip, each elbow, each section of the back. It's frustrating, can't do it all in one go, but that's just the way it is. But it's very simple. We've got an open MRI to analyze all of that. And once that's done, we get you back to your hotel so you can rest and relax or enjoy the beach.
So we have ready the pictures and the report from the MRI from the left knee and the prostate ultrasound. So our protocols includes like the MRI. We have an MRI machine here inside. And for the prostate treatment, we include like the ultrasound. So during this consultation, I'm going to show to Ross the pictures, and I'm going to explain him and to know if he's candidate or not for this treatment.
DBC Diaries Day 3. Ross and Vianey are coming in for the consultation. They're going to sit with our doctor. They're going to ask any questions that they have, any doubts, concerns, anything like that. The doctor will answer, and he's going to go through their blood work line by line so they really understand it. Big thing I don't like with docs in the US and abroad is they typically don't explain what these different markers mean. Our doctor is going to explain what they all mean, where your range is. He'll offer any like dietary recommendations if things are slightly off, but this is to make sure that you're healthy. We want to make sure there's no signs of cancer or any major issues. And then you also have something to compare to in the future. We see a lot of patients with high cholesterol or liver or kidney markers that are off, and after treatment like an IV, back in order. So now you've got a baseline. Anytime you come back, we do new blood work. Then the doctor's going to go through the MRIs. It's going to go image by image, explain everything, tell you what it means, and let you know if you really are a good candidate or not. So full analysis, all your questions answered. And when that's done, you come upstairs, you meet with our management team and take care of payment. And then the next day, we'll be ready for treatment. DBC Diaries Day 4. Today's treatment day. So you come in and sit with the doc, make sure everything's all good, any last questions, and then we get going. With the IV, it's super simple. You relax in one of our recliners. The nurse puts the drip in, and our nurses are so good. They rarely miss on the pokes. And just in case you're a hard poke, just know we've also got like the newest, I believe it's the infrared scan so that we can find the vein finders. We usually don't need them, but we have them just in case. And yeah, you sit on the drip, you relax. Takes anywhere, depends on the IV, like 100 million IV typically is going to take like an hour to an hour and a half. 200 million IV, hour and a half to 2 hours. 300 million IV, right in about that same range. So it doesn't take that long. And then for the injections, like the knee, like Ross is doing, it's such a quick, easy injection, very simple. The doctor goes through that. So stay tuned now. We're going to watch an interview with Ross and Vianey explaining how treatment went for them last time, how it's going now, how their bodies are doing, and health and everything else.
Hi, my name is Rebecca. I am nurse. Today Ross will undergo a knee and IV treatments.
All right, welcome to DBC Diaries, episode 37. I'm Josh, and I am here with returning patients, Ross, Vianey. Thanks for coming back. And you were here, when was it, last year, right? I think in about April?
Yes.
Right? And so you both did the IV like you're doing now, and then I think we did your knees, right, Ross? And this time we're doing a few other treatments. So we just wanted to check in, see how you're doing since last time and what's been going on.
Doing good. I mean, obviously we're here in less than a year's time because we felt like we got some very good benefits out of the first treatment. I got 2 knees done. They were both bone on bone at that time. One of them couldn't save it. The other one feels like it's better. The MRI isn't really showing that necessarily, but it definitely feels better. So we're going to give it another shot, see if maybe we can save that knee. And I'm sold on it. I want to get my elbows done. The IV seemed like it helped a lot. I went to the gym as soon as I get back to America, and my personal trainer, he didn't know where I went or what I did. He said, you've got like your bench press and all these metrics have come up 10 or 15% in a week's time. Wow. He said, what the heck did you do? And then I told him about it. So, I don't know if that's necessarily what it was, or it was maybe a combination of taking a week break and then the stem cell IV as well. So
no, I think there's a good chance it was the IV. I found the first time I did the IV, I did the 300 million. Yeah, I was patient number 1. I got to do the high dose, make sure. And I put on like 10 pounds of muscle over the course of that year. And it makes perfect sense. They seek out inflammation. Well, what happens when you work out? You're inflaming the muscle. So you send more there to repair. You tear the muscle, you rebuild it. Plus they help create more neovascularization, which is new blood vessels. So it's, I wouldn't doubt it if it was really helping you there. It does for a lot of people. That's great. So that's what you saw. And did you notice anything, or how are you doing?
I wasn't expecting, I came in here with the idea of trying it. And when about 3 months into having the stem cells, I have spondylosis, my lower back. I didn't come here for that, but it was incredible how the pain in my lower back has disappeared.
Oh, wow.
And it's still gone. It's almost 9 months. Mm-hmm. I didn't expect that with this treatment, but my lower back pain is gone, as well as my vision has improved.
Oh, really?
Vision is improved. So those are the two benefits that I've seen so far, and I was sold on it. That I'm gonna decide to come back and do it again.
And we're be more than likely need to see yearly thing.
Oh, that's awesome.
Now the benefits and it's helpful.
Oh, that's so good to hear. Now, we've had a lot of people with like back pain. I mean, a lot of times we'll do the more targeted, but my mom, for example, she had to have a fusion in her back years ago, and she could barely play tennis after. That's like her life. So she only did the IV. She was too afraid of the needles in the back, and that was enough to get her playing again. So I'm glad it's working for you. I mean, it's clearly reducing inflammation and repairing tissues. And there's a lot of anti-aging benefits, which I'm sure you guys are feeling, and you can't always necessarily feel them, but when you start doing the tests, the data, like if you go home, you might look into doing one of these DNA methylation tests.
Yeah.
You spit into the tube, you send it off, and they'll check your epigenetic age versus your actual age. And we just keep finding people's real or epigenetic age is younger, and especially as your second one. So you should see like a pretty big reduction there, which would be pretty cool to see if you want to do that.
And skin.
Yeah.
The elasticity of my skin as well. Somebody say.
Yeah, people forget the skin is the largest organ in the body, and of course it's going to receive cells during that process. So it really helps with skin tone. A lot of like much older patients report, they start saying their skin feels thinner as they age, and doing the IV seems to really help that there too. So yeah, it's a huge benefit on all the organs in your whole system, and just like we said, this biohacking, want to keep that age thing away because it's creeping towards all of us, right?
Yeah.
Well, cool. Well, thanks so much for coming again, doing treatment, and I don't know, anything else? You guys, how you feeling? All good?
Yeah, feeling good. I think one thing I would say, one of the, we plan on coming back probably every 9 months to at least get the IV and maybe some joints done as well. But, we're at a kind of semi-retired age now where we love to travel, and a lot of the travel that we like to do at this point is more kind of off the beaten path kind of travel, where we hiked Machu Picchu a couple months ago, and it's it doesn't do much good if you've worked hard your entire life, saved your money, and then your function is down and you can't enjoy doing those kind of things. So a lot of what we're trying to do is more preventative to make sure we can enjoy our 60s and 70s, or you're 53, but make sure we can enjoy those years that we've saved and worked so hard for. So
Great.
To me, it's like such a small amount to pay to enable you to enjoy those years. If it's kind of a no-brainer to me if you have the ability to do it.
Totally. I couldn't agree more. I mean, obviously it does cost. We try to keep costs low as we can, and you compare us to some of our competitors, it's a huge difference.
Yeah.
But it still costs. But if you got to invest in yourself on something, and like you said, I mean, I see so many guys get to retirement and then it's like they're done. Like they can't even enjoy it because their body's broken. So we're trying to help people prevent that. So I find the younger you start, the better. I mean, look with your knees. I mean, they're kind of at the end there, but I mean, you told me you hiked the whole Sacred Valley. I mean, that's pretty awesome. Well, cool. Well, I'm so happy you guys are doing so well. Thanks for doing this to help share with people at home. And if you at home have questions, you want to learn more about stem cells, you can contact us anytime. You can go to the website. It's www.dreambody.clinic. You can scroll down on the homepage. You'll see all the treatments listed. You can click all the info, prices, everything's there. And yeah, I'm Josh. Happy to help. DBC Diaries Day 5. Well, that's it. So Ross and Vianey are done today. They're going to head back to the airport. Our driver will take them, and good to go. Well, actually, they're not going to head home today. They stayed a couple extra days, what will show our driver taking them today. But yeah, you don't have to stay the minimum amount. Typically for a joint, it's a 5-day trip, but if you want to stay a week or two, No problem. Vallarta's got some great things to check out. Ross and Vianey went out to this little surf town nearby called Sayulita, had a great time out there, really good waves, great food, great place to hang out. So many cool things to do here in Puerto Vallarta. And if you go to the menu of the website, www.dreambody.clinic, there's a section where it says how to book treatment. If you hover the mouse or your finger over it, you'll see there's a drop down and it has a link for activities, which lists all the cool things you can do in Puerto Vallarta, the different tour companies, lists hotels, lists restaurants, so you know the best places to eat. And even outside of that, there's so much more. It's tropical paradise here. So if you have questions, please get a hold of us anytime. You can call us toll free at 888-704-3977 or go to the website, www.dreambody.clinic. Scroll down on the homepage. All the treatments are listed. Click on the links, prices, info, everything you need is there. I'm Josh. Happy to help.